achieve. All right. So we're trying to look at how we can manage the reputation of an organization as a public relation officer. Like I said earlier, as a public relation officer, you have to be proactive. It's not something that you wait until when you are asked to do. It is you that will inform. In a situation whereby a public relation officer in an organization is being asked to do something, it means something is wrong. That means the aim will not be achieved. So we want to be proactive. So part of this task or strategies that we can adopt in managing the reputation of an organization as a PR officer is media monitoring. You have to monitor, I've said this earlier, you need to be monitoring what is going on in the media. If you are a PR officer and your duty, the way it will see, is for you to just sit down in the office and wait for information to come, then you shall be not to go. You must be in virtually almost all the media as best as you could. Sometimes those information come in the night. Anytime an information can come. So if you are not proactive, a minute is enough to damage the reputation of an organization. And that's why sometimes, sorry to use myself as an example, I hardly go offline. Sometimes 12 throughout the night, I can get the information. And as I'm present, I think I have subscription to almost 38 online newspapers. So with that, it is very difficult if in one particular media outlet did not capture a particular news, the other will capture it. That's just it. So sometimes we don't utilize social media. All we need to do just we are spending money on data and then doing something else. You can get yourself equipped. In fact, even for you to even get abreast what happens in your environment is something else. So this is something we have to take very seriously. Then crisis communication. You need to develop and implement crisis communication plans to address community events. Like I said earlier, such as patient safety issues and medical errors. If you go around a hospital and you discover probably the patient may not come and inform you, or the patient relative. Like someone maybe, I don't know if it's one of the management staff stated earlier, you can go and flash. Pretend to be a patient or a patient relative. Before you know it, you get information from them. Right there and then, you know what to do. If it's something that you can address, you do. If it's something that you cannot address, send me your report, forward it to the management. Sometimes, you can even burn a cake. When patient relatives are going out, if you really want to do our job, you can burn a cake to unknown destination. When I mean unknown destination, you don't have destination. Don't get a point and just step down on the bed from the KK. What are you trying to do? Want to better information? You can initiate a discussion with the patient relative. In fact, this hospital, I don't know what is wrong with them. Look at my experience. Just for you to get information from them, you may not know the patient may not know what you need to get those information that you really need. They will not want to tell anybody, but you pretend to be patient relative. because you know it's a problem that is uh, happening within the system. So you can equally adopt different strategies. And by the time you get all this information, you now channel whatever report you have, forward them to the management, and then whatever issue that is there, it will be resolved. Storytelling. Can share stories. By telling stories of whatever that's happening within the center, in terms of whether it could be electronic, it could be in written form, to spell out some of the achievements of the center of the organization to patients. Reputation analysis is also one of the things that we can engage in managing the reputation um, of the institution. Then stakeholder engagement, I've been mentioning this. Then issue management, by identifying and addressing potential issues before they become a major problem, such as patient complaints and the concerns. Like I said, you can go around, come in the morning, go around the hospital, see what is happening, hear the complaints of the patient. You cannot avoid that. From there, you can now see how you can design a plan on how to address some of the issues. Then online presence, as I've said it, is something that just for us to be from time to time to monitor whatever that is going on in the center. Employee ambassador. Here you encourage the employees, the staff, to be ambassador of what? Of the center. Not just the information unit alone. Everybody should come, a PR to the center. They will now engage community outreach. Maybe probably there's a complaint from the community. You can meet the community leader. We have this is what the community members are complaining about. And this is the intention of the management or the institution carrying out such policies. Then right there and then it will be resolved. Instead of leaving the whole thing to just be going down to their reputation repair. Here you address and resolve reputation that's already been damaged. You carry out some strategies that will ensure an effective image repair. Here, we mentioning some communication strategies. What are the communication strategies can we adopt in managing the reputation of an organization? One, transparency. Be open. If there is an issue, you don't need to hide it. Admit. For example, if there is a medical error, as an institution, admit that yes, it happened. Then you now think of how to remedy that particular situation. But if you stay on a win a move, definitely the patient will go to any level. And I believe this center has been doing that. There are instances where there are medical errors, but the management will go down, in fact, even bleeding, and the whole thing will be resolved. Like you not even need to litigation. Then proactive media relations, building that relationship before an event will come up. You don't just wait until when you have a program before you now meet the media. Always you should be having the contact of those media outlets at least from time to time just to come call and greet. Just that's all. Call them and just call to greet you and resolve. By that you have established relationship. If there is anything that comes up that may affect that organization, they will be the first to draw your attention. We have resources, information concerning the organization, how true it is before they will even publish it. But if that report is not there, it will be deadly. Then career engagement, we have said this, and then patient feedback through patient survey, which I've mentioned earlier. Then social media engagement is also one of the strategies that can be adopted. Crisis managing, communication planning, as well as stakeholder engagement and reputation monitoring. So these are different kinds of strategies that one can adopt in making sure that there is what? a good reputation of an institution before it's public. Clear messaging. Whatever message you are passing across should be clear, devoid of ambiguity. So if you are passing a message that is ambiguous, definitely it will be subjected to different kind of interpretations. Probably what you meant different from what you interpreted. So it has to be what? Clear message. Employer ambassador will have said this, community outreach, internal communication is very vital. The community you are serving, especially in this hospital, they must know every detail about what is happening in this center. It is it will be unfortunate that a community personnel, somebody is working here to get something about happening in this center from outside about a particular policy. If it don't means nothing is happening, we are not doing the job is not being carried out effectively. Then patient advocacy, carry out advocacy to the parent, to the patient. Go in there where they are saying, good morning, how are you feeling? Do you have any problem? And before you know, if there is any issue, they will inform you or brief you. The media training, providing media training for staff and physicians to effectively communicate with media. Here, this is where the job of the training unit comes in to make sure that those personnel, the physicians, the nurses, they should be trained on effective communication strategies. Very key. At least from time to time, they need that training. By is something that has to do with then repetition analysis, conduct regular repetition analysis to identify. Sometimes you can design a template to carry out maybe how do they feel. It can be the staff or even the patient. What do they feel about the effort of the management? It's the duty of the public education officer to do that. From there, you can get the views of the staff, the patient regarding the center, and then you can advise appropriately to the management. So, by implementing all this, we believe that trust will be built, and then between the stakeholders, and we promote the values based on the vision and the mission of the center. So, I think this is the end of the first segment of the presentation. Now, the case study which I want us to look at, and then we discuss among ourselves. How do we implement it? We look at the case, looking at the FMC as a case study. How can we implement such uh, case in this center? We have case one and case two. So give us like 5 minutes to go through, and then we hear our view. How can we translate these views into FMC? Because one of them has to do with hospital-related issue where public relation strategy was being employed, while the other has to do with a retail good company that has a particular issue with the public and how it was handled in a professional way using the public relation aspect, communication strategies. The 3 minutes or 5 minutes, so go through it. Then we now comment based on what we have listened to, and then what we have. How can we, if such a case happen in this center, how do we address it? In London, where the what do you call it, the privacy record of Ferguson was tampered with, and then comment please. What do you think if such a thing happen? How do you think the management should handle it?
Uh, which one all? Uh, my thought on this is I think before this things happens, I think there is measure that need to be taken in order to prevent such occurrences. Because it's a serious case. A staff in the hospital disclosed the clinical record of the patient without his consent. It's a serious case. So if that is happened, I think the person that uh, having to find himself in that act need to be called upon and ask him why did he did that. And then the second aspect of it, the person that is information has been disclosed or exposed, the management will need to call him and sit with him to discuss with him so that you know how to write feeling with him. The things will not go to have to be litigation or court something like that. I think that's two things I can say about this.
Any other person? Any other comment, please?
Yeah, I don't understand the question.
We have a case
Uh-huh.
of a staff disclosing a personal information of a patient. The issue of confidentiality is based on here. So if such a thing happen, how, as a public issue, how would you handle it? Because you are supposed to report what strategy to be taken by the management as if that this as your field. So what professional advice will you offer?
Well,
Okay.
as a staff of an organization, it is your responsibility to maintain the reputation of your organization. So I think leaking out information is a great offense. Now it says a staff, we are acted by a staff without a valid clinical reason. This privacy violation could have significantly harmed the hospital's reputation. So, transparency. You have to be transparent in everything that you are doing, and you have to be secret. You don't have to leak out information anyhow without having valid of that information.
Okay. I think the management need to be associated himself, started from certain acts, and the officer concerned should take some series of disciplinary actions. I think this is my observation. Thank you.
Good morning. My observation here is that there is need for a staff sensitization. Those staff that are related to keep that record, they have to be time to time enlightened about the importance of confidentiality of the record. Appropriate taking care of sensitive data of the patient or any data of the hospital.
All right. Good morning, everyone. My name is Emmanuel A. I want to also chip in based on the point raised. In respect to that, in a situation where there are confidential issues, more especially has to do with health, it's more confidential, and one have to keep secret. If there is no secrecy, definitely that organization would crack down, that is, it would decline. Then, as a public relations officer, being intermediate as the image maker of that organization, in case study of FMC Google, your responsibility now, when you discover that, is to come in between, because the vital role you play, you have to protect the interests of the patient in particular. Let me make an example of which I'm not wishing. Some take it as a death warrant. Let's say somebody that often visit ART also, they call them ART. Yeah, those with HIV, it's not a death sentence. And while it is confidential, then you going on telling people, and also already you are discrediting the center. So as a public relations officer, when to get your notice is to draw the attention of that person in particular, get him informed, let it sound as a warning, but it should also take an example as let it be as example by following the proper channels, taking it to the top management where I think the discipline is supposed to be implemented on that person. That should be a warrant to others. And for the patient now, as rightly said from the first segment, we have to protect the right of the patient. So you as a public relations officer, you should be a smooth talker, not that you be someone that will fuel the whole thing. I think that committee I can people like I don't think you go do whatever you want to do. This thing is bad as an image maker. Completely, you contributed to the downfall of that center. So you should be a smooth talker. Please, this thing happened. I'm so sorry. We are going to look into it. Please, moreover, this thing that you are facing with, you are not the only person. Even I speaking to you, I have some people in my area that are living fine. It's not a death center. That's how you communicate to someone. Immediately, you will get comforted. You will be consulted. Then you feel, okay, there's no problem. I think that is my submission, sir.
Thank you very much. I think we have all said well. One, we talked about staff engagement, which has to be, if a case like this happens, there should be, you have to please the patient, please forget about the hand. Then talk about the issue of being transparent so that you can win the trust of the patient. Then we have the management should disassociate itself from such an act. Then carrying out disciplinary measures, staff awareness creation. I think the first thing that the management should do as a public relations officer to advise the management is for them to admit and lay apology, and apologize to that person in the patient. Because when you said it is our staff, it is not the management, and you push it, it is going to be dead. So the first thing you should do as a public relations officer, the first advice you give to the management is for them to admit the fact that yes, such a thing happened and it is wrong. Then the issue of disciplinary comes in. By doing that, you are now being seen to be transparent in whatever you are doing. But then, before all these things will happen, that's why we talked about the issue of being proactive. And being proactive, how will you be proactive? That's where the issue of awareness creation comes in. First of all, carry out the awareness. Let everybody know that somebody might know, but sometimes you are human. Due to one reason or the other, you might be tempted to do it. So when the awareness creation is being carried out, it's done. And that leads us to the second, the other case study, where it was the case of a company called Milo Pizza turnaround. It's US. They were producing some products along the line. Just like that, they produce products that are not of quality, and the customers started complaining. What's that complaint that what they are giving to them is not of quality as it used to be? The first thing they did, they came and admitted yes. In fact, they had to even go for advert. they advertise their product that yes, actually it is faulty. I don't know how you look at it. If it were in the case of Nigeria, I don't think they would even admit. They will stand their ground that no, it was an adulterated product from somewhere. But they admitted, even if they were the one that produced it or not, what they did was just to admit. So in essence, what we are saying here is that, and by the time they admit, they now, in fact, even went to the extent of even paying back some of those persons, those customers that bought those things, they pay them back and even offer service free of those products to them, just to down the tension. At the end of the day, after this, it was said that the company started having more customers because the customer now believe that yes, they know what they are doing, they are responsible. They were able to redeem their image back more than what it used to be. So here it's just like for us, just like an eye-opener for us to see. If we have a particular situation, how do we go about it? It's not for you to go and advise the management. Don't accept. Because if you accept, they will take you to court. Admit first. Admit that yes, something has happened. Then you now go apologize. You can now engage your stakeholders that can come in between. These are some of the things that, as a public relations officer, you are expected to do. Not that you are there as police officer, there are issues in the center, you just sit there and just watch it. You are waiting for the management to, okay, what we will go and do, no, it should be proactive. So, I think this has brought us to the end of the first segment. Then we now move to the next stage, which is what is more applicable to us. I am a media relation officer. Am I doing my job? I am a corporate relation officer. Am I doing my job? I am a customer relation officer. Am I doing my job? I'm a program officer. Am I doing my job effectively? And then the issue of protocol. Just as the DA rightly stated, it depends on the organization. There are some organizations that don't even have protocol. Everything is embedded into the public relations. So public relations and PR, they carry the same function. And that's what the first presentation is targeted at, where everything is inbuilt. But in a situation whereby they are separate, we have protocol unit and then public relation unit. These are different things. But in our case here, everything is fused into one. You know, before now, there used to be protocol officer separate outside the information unit. But now, everything is the same. So now, let's look at the role of the customer relation officer in the hospital. Like I said, we have to critically look at some of these responsibilities, these roles, and we assess ourselves if actually we are doing them. A customer relation officer in the hospital plays a crucial role. Yes, CRO, thank you. In ensuring patient satisfaction, building trust, and fostering positive relationship between patients, families, and hospital staff. Now, what are the key roles or responsibilities? Patient feedback. As a customer relation officer, you are expected to collect and address patient concerns, suggestions, and complaints. Like I said, we have Telecom. Yes, Telecom have their role to play, but as a public relations officer, you can synergize with Telecom. They might not be there all the time. There are some things that they will see, they will observe. You might not observe. And there are things that you might observe and they will not observe. So, as your duty, you carry out surveys, which I have mentioned earlier. Carry out surveys periodically. It can be monthly, can be every month, every 2 months, can be quarterly, depending on how stable it is. So that based on these complaints or concerns, you can now design a plan, a strategy for the management to embark on. Issue resolution. When some issues are raised or complaints, if there are some that you can address, if there are some that can be really addressed right there and then, you address them. Then if beyond what you cannot address, you report back. Communication. You facilitate the first connection between the parent, family, and office staff. If a patient or a patient relative is dissatisfied with a particular policy of the center, it is your duty as a customer relationship officer to let them know that yes, this thing you are doing is for your interest. So that you let the patient and the patient relative to be aware that this thing they are doing is for your own good, not that they are doing it to harm you or to inconvenience you. So that communication has to be there. Patient education to educate, to enlighten the patients. Sometimes you can even offer support and empathy. Sometimes you are moving and you see a patient lying on the ground. It has been happening. If actually you are going, you see an elderly person lying on the ground, or maybe sitting down in such a way that it is not something good looking. What do you do? Oh, but what is happening? What is it are you looking? What are you looking for? Where are you going? What is your problem? What kind of service do you come in for? Sometimes some will come, they will not even know where they are going, they just sit down. I remember sometime when we were on a routine visit to the clinic with the medical director, we saw another person with the son. They just sat down. Seeing the elderly man, you know that hey, he needed an assistant. Sorry? He needed an assistant. So he was asked, Baba, what is the problem? He said they came all the way from the jail. They came and they discovered that place was locked. So they had no choice than to come and sit down here. And right there and then, they were attended to. So as a customer relationship officer, this is what we are to be doing by providing support with some cases. Then service recovery. Implement recovery strategies to address patient satisfaction. If such complaints are made, how do you make sure that they are satisfied with whatever service that we render to them? And then training. I talked about the short training the other time. It is a duty because as a customer relation officer, you go in, you know what is obtainable there. How the staff are handling the patient and how the patient are responding sometimes to the staff. You have more like first-hand information about it. So when there is need for training, you are in the right position to offer such training to them. Patient advocacy, I've said it earlier, data analysis, you collect the data, quality per se, there's a survey, you analyze and then you report. Quality improvement. You now design a strategy in which how these the services can be improved upon. Then management of complaints, making sure that the patient is satisfied with whatever service that is rendered, and then family support. Sometimes maybe when a particular family has a particular challenge, sometimes you can even be an intermediary between them and social welfare. Then talk about follow-up. Very, very important. If there is an issue and you address it, you need to follow up. Was that issue addressed? So by the time you do this and all these things are being taken care of, you discover that everything will work smoothly. You cannot avoid the fact that there will always be complaint. There will always be dissatisfaction. But at least it will be reduced to a very minimal. Then, as a program officer, what are your roles? In a hospital setting, the crucial role is planning, implementing, and then evaluating. You plan, you implement, and then you come back and evaluate. Those programs that you have planned, was it, do you achieve the target aim or not? One, program plan, you develop and implement programs plans and goals and objectives based on the vision and mission of the center. Then, project management. You manage specific projects by ensuring that timely completion and budgeting is being done. If there is budget involved, money involved in planning, it is your duty as a program officer to design the budget, and then it will now be implemented. So if a program officer is existing and the media relation officer is being asked to design a budget, means something is wrong. So we just have to do what is right. And it is not the duty of the program officer to go around and check, make whatever that is going on as affect the patient in terms of serving delivery. Though we can work in synergy. Coordination. It coordinates with hospital department staff and external partners. If there are programs in any of the units, it's the duty of the program officer to make sure that everything is done perfectly. And then we monitor, as the program is going on, at least we monitor to ensure that there are no issues. And after the program, we evaluate what is the level of success being achieved. And then you report. After you are done with the evaluation, you now write a report, brought it to the unit. Then it's possible, you can if it demands everybody sitting down in the unit to discuss on that report as a way forward, then fine. Sometimes you engage stakeholders, could be internal or external, depending on the situation or the program you are embarking upon, the quality improvement. So with this report that is being put in place, it will guide work in making sure that there is an improvement in whatever program that is to be embarked upon in future ones. Then policy development. By the time you put this together and it is being submitted probably to the management, it to help them in subsequent programs. If there are challenges, you will now find a way of work, making amends in subsequent events. Staff support, providing guidance support to staff, program staff, promoting professional development. That is more like everybody in the unit. Make sure that at least everybody does his or her schedule effectively. If they are going out for the program, okay, you do this, you do that. Community outreach. If we are going out, yes, it's a program. It's designing the program and making sure that everything is done the way to specification. Then grant writing. Such one of the rules. You research and write grant proposal to secure funding for programs. If it's something that has to do with going outside, you write and then you forward it to the management. You look at it. If it's okay, then you may give approval and then we move on. Program promotion. You can call it service program promote programs. And equally data analysis. Was all those the evaluation to carry out, sit down and analyze, which will help you for packaging your report. Then compliance. Ensure that these programs that are being designed are in line with what is being meant for. So if all these things are the commission officer is doing this, I think we discover that everything will move smoothly. Then we have the role of the corporate relation officer. As the corporate relation officer is more like someone that is more closely related to public relation duty of the unit. Because his role has to do with building and maintaining relationships with external stakeholders, promoting the hospital's image and reputation, and advancing its strategic interests. That is what is expected of a corporate relation officer. In some organizations, you are not really hear public relation officer. What you hear is corporate relation officer. It depends on the organization. Then one, stakeholder engagement. I don't need to mention because, like I said, I've said that during the general introduction. You engage the stakeholder, business development, you identify and pursue business opportunities for the organization. It is despite the fact that this is a service rendering institution. There are things that the hospital can do to get money. There is no harm if the hospital discover that we have staff within the institution, and these staff they have children, and these children must go to school. There is no harm if the population officer will design a proposal and forward to the management. Look, there is need for a staff school in this center, and this is the proposal. That's the marketing and promotion. Then, event planning. In conjunction with the program, you plan for an event to make sure that, because if you are going out for an engagement, something that has to do with engaging with the outside community, it has to be planned. It's a program. So that's where the planning has to be in conjunction with the program officer to make sure that this is done smoothly. Then public relations, I've said it earlier. As a public relations officer, you are more of the public relations person in the unit. Event plan, I've said this. Fundraising and development, just like we have said earlier. Then, if there is need for fundraising, the corporate relations officer will make a proposal, you make a plan, and then it will be forwarded. Government relations, you relate government agencies. By making sure that you build and maintain a good relationship between the institution and the government. Where this is functioning properly, this is what is expected. Community outreach, brand management, strategic partnership. I think I've said this, I think we can reflect back. Then we have market research and analysis. For example, we talk about the issue of, I brought an example of establishing a school, a staff school. Before you even come up with this, you have to carry out an analysis, carry out a research. Is it viable? Yeah, the nature of staff we're having, would you be able to afford? Because whatever you are going to afford, you're going to serve, you're going to render, it cannot be compared with what's obtainable elsewhere. Yours should be the best. And if you are offering the best service, you pay more. So, would they pay? Would they have the ability the willingness or the ability to pay? You carry out the feasibility study before you now write the proposal. And then compliance and risk management, by ensuring that compliance with regulatory requirements and managing of risk is ensured. So these are the roles of a corporate relation officer. Then we move to the next role, which is that of the media relation officer. So media relation plays a significant role in a health institution as media outlets serve as gatekeepers of information and have a profound influence on public opinion. So somebody has to be there to serve as a go-between the two. So establishing strong relationship with local and international media is crucial for organizations seeking to gain visibility, share narratives, and effectively communicate their messages. If you are not drawing your trumpet, nobody will do it for you. So, a media relation officer in the hospital plays a crucial role in managing the hospital reputation and communicating its messages to the public through the media. He serves as the media liaison. I've explained this, I don't need to explain that. Press releases, the duty of the media relation officer to issue press releases and distribute to the various media outlets. Media monitoring, monitor what is happening in the media to see if there is anything that is affecting your center or your institution. It's your duty to report back immediately. Crisis communications. We have explained this earlier. Interview coordination. If there is an interview to be conducted, it's the duty of the media division to conduct or coordinate such interview, either within or outside, during press conferences or internal interview, whatever it is that has to do with either the patients or the physicians within the center. Story pitching. You proactively pitch stories and ideas to media outlets. You don't need to wait for the media to ask for news or information about the center. It's the duty for you to forward those things to them so that they now go ahead to publish. Media training. Just as I said, provide media training for hospital staff and physicians, just like the role of the customer relation officer. Then reputation management. You can see that this keep on repeating in almost all the rules we have mentioned. Internal communications is also the duty to make sure that staff keep abreast of whatever that is happening within the center. Policy development, contribute to policy development and and procedures related to media relations. Sometimes the management might not be willing to send one or some messages to the public. It's your duty as the media relation officer to make sure that they see reason why this particular message should go outside the center. Community outreach, as they are going, you have to be there to make sure that whatever that is being discussed here is being disseminated to the public, back to the public. Social media management, photography and videography. It's also a duty to coordinate visual assets for media use, either in form of video or pictures. The media events, the organizers and coordinate media events, press conferences, and announcements that we carried out during programs. Then compliance, making sure that all these regulatory bodies, policies that have been enacted are being followed up to the latter. Then we now look at the case of the protocol officer, which is also has been applicable to the FMC group here. The protocol officer in the institution plays a crucial role in ensuring the smooth operation of various activities or events and interactions. One, coordination. He organizes and coordinates events, meetings, and visits, including scheduling, logistics, and arrangements. This is the duty of the protocol officer to carry out. Etiquette and diplomacy. He ensures adherence to proper etiquette, diplomacy, and cultural sensitivity in all interaction. It's the duty of the protocol officer to make sure that everybody is being, the system arrangement is done properly, and everybody is being arranged. Even the protocol, the way everybody will be addressed, it's the duty of the protocol officer to do that. Just as being mentioned by the director of admin, it is wrong for you to, when you are introducing maybe a permanent staff, and then you now have someone who is the head, but not a top management member. Don't forget that there are two things. You can be a head of department, and this other person can equally be a head of department. One of them might not be member of TMC. So if you are going to introduce, who do you introduce first? To the person that is a member of TMC, though both of them are what? Heads. If you have head of units, head of departments, who is to be called first? Head of department, then the head of units. And when you have head of, in charges, so that's how the ladder goes. So it is so if these protocols are not being observed, think the protocol officer will be held responsible. Visitor management. Yes, you manage the visitors, making sure that when there are dignitaries coming in, it's the duty of the protocol officer to make sure that they are being attended to and accorded whatever respect that he or she deserves. Planning of events, conjunction with the program officer, and then ceremonial duties, master of ceremony. It's equally the duty of what the protocol officer, yes, to carry out such duties. Then discretion and confidentiality. As a protocol officer, you deal with high-profile individuals. It is unprofessional of a protocol officer to go about revealing the secrets of whatever that has happened right behind the scene. If you go about telling people, this man, this, that, and that, you should what? It's very, very important to imbibe that spirit of what? Confidentiality as a protocol officer. By conclusion, we said public relations effectively communicate the changes that the company is bringing. These changes can be in regards to its policies or in other domains. Public relations in health plays an essential role in carrying the agenda of any healthcare business. There are many competitors in the industry, which makes it challenging to get noticed by the people, just as we have here. At least there are instances where sometimes some of the patients will tell you to prefer to go to Malam Baba's hospital, depend based on some of the way they were being handled. We had such cases. It's not a new story, it's not a story. So there are competitions. How do you avoid it? That's where your role as a public relations officer will have to come in. So it helps companies to reach a place where they can easily be distinguished among the crowd. And by implementing these strategies, an information and public relations officer also can help maintain a positive reputation, build trust with care stakeholders, and promote the hospital values and mission. And I believe with all this, with synergy, we can turn the round of the club. Thank you very much for listening.